Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk to you about depression in children. Often people don't realize that children can be depressed. In fact, they think childhood is such a happy time and how can they be depressed? And further, to add to their confusion, though depression does include the four main factors of loss of interest or pleasure, low self-esteem, sleep problems, and appetite changes, like in adults, but these problems are clouded by the child's developmental age, and because they are unable to express their feelings, the picture of depression in children is often different, and this is called masked depression, where the child may be more aggressive, oppositional, or disruptive. Treating depression requires clear understanding of what depression in children looks like and evaluating those symptoms. Laboratory and physical examination is important to rule out things like anemia, thyroid problem, and others which can also contribute to depression. It's important to identify environmental contributors like bullying or learning problems, and to understand the impact of this complex disorder in the child. So as I told you before, problems like diabetes, hypothyroidism, chronic infection, problems like asthma, anxiety, all this can give rise to depression. 28% of children who are anxious are depressed. Children who have learning problems, language difficulties, in fact 70% of these children will be anxious and 57% of these children will have depression. Certainly bullying and parental abuse gives rise to depression in children. Before we make treatment decisions, apart from making a specific correct diagnosis, it's important to differentiate depression from normal grief, adjustment disorder, like when a child has relocated to a new place, so they may have mood problems that time, and from bipolar disorder, because childhood bipolar can and should be treated differently. Apart from different psychological treatments like cognitive behavior therapy, problem-solving therapy, and interpersonal therapy, where the child is again helped to identify and cope with their thoughts and feelings, to change their distorted thinking processes like magnifying up problems or catastrophizing a situation or focusing on negatives rather than positives. So these are identified, and then the child is taught how to get over them. Medications can also help and are given to some percentage of children, especially the SSRIs, which are FDA approved. Lifestyle changes are important, so regular physical exercise and nutritious healthy diet, yoga, breathing techniques, and of course helping the child make friends, social training will also help. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.